Hello, hello, dear colleagues. My name is Dr. Elias Mengistu, and today it's a pleasure to present our work on the study of brain circadian rhythms in patients with chronic disorders of consciousness and healthy individuals by using microwave radiothermometry. I represent the Federal Research and Clinical Center for Intensive Care and Rehabilitation and Guggenheim University as well. Allow me to say a couple of words about our research center that has been established in 2016, and till now more than thousands and thousands of patients were admitted, treated and discharged from our center. It has 3 floors of fully equipped intensive care units with a total of 50 ICU beds. It has a rehabilitation center and separate center for palliative care as well. The patients who are admitted to the center are those who got treated on the primary and secondary healthcare facilities and that have been referred to our center. Most of them, they are admitted after the 30th day of cerebral insults. So basically, we are dealing with patients that has survived in acute phase of the cerebral injuries. They went to comas and did not enter the brain death stage nor return back to their normal conscious state. So they're stuck in a state which is called the disorder of consciousness, and it implies of being in a vegetative state or a minimally conscious state. So the main research area for our center is finding a solution or methods of influencing the recovery processes for our patients so that these patients, they can return to their normal conscious states and go back to their normal lives with their relatives and families. So the main problems that we are facing while working with the patients with disorders of consciousness is that these patients, of course, they are unique, and unfortunately, there are no uniform recommendations and standards for diagnostics and patients management yet. Despite all of the innovative technologies in medicine that we have, these patients most of the time are examined by the neurologist, and the diagnostics prevail to the neurological exams. And most of the time, the neurologists, they use the Coma Recovery Scale, the revised one, of course. And it's quite competitive, and we face a lot of challenges nowadays as well. So I think it will be more helpful if our diagnostics arsenal can be replenished by at least one diagnostic tool, which will enable us to ease the work of the doctors who are working with such unique patients. Going further, we can say that the specific principles of therapy and, of course, rehabilitation of our patients have not yet been developed. And it's quite, again, challenging for patient management in our center. Besides that, there are no well-known predictors of outcomes, and maybe that's because we are lacking of a deep understanding of pathogenesis and processes of recovery in patients after coming out of a coma. So when we're looking at the patients in the acute phase of brain injuries or other cerebral lesions, most of the published data and the information on the resources, they refer to the body temperature and brain temperature, which in fact gives us and leads us that the patients with an increased body temperature had a worse outcome than those with a normal thermal. So basically, the brain temperature and the body temperature can be used as a separate predictive factor as well. Adding to that, severe brain damage, which causes, of course, the disorders of consciousness, might disrupt the activity of the central oscillators. It could be by direct damaging or destroying the periphery links. And of course, we can say that the level of preservation of the circadian rhythms can be an informative diagnostic criteria for the patient's assessment. So we started looking for the main methods of cerebral temperature measurements, and in most cases and mostly routinely and easily used is an indirect assessment by measuring the basal temperature in different body areas. It could be the rectum, it could be the esophagus, the bladder, or the tympanic regions. But unfortunately, there are many contradictions whether the body temperature can truly reflect the body temperature, the brain temperature. So many articles indicate that the acute phase of cerebral injury, and in almost 33% of the patients that have developed the hidden brain hyperthermia without an increasement in body temperature, which shows us that not in every cases while we're measuring the body temperature, it reflects the brain temperature. So therefore, we continued our search towards more informative methods, one of which is the invasive methods, which of course implies the emplacement of the brain thermosensors or the brain probes. And it's a fact that it guarantees reliable measurements, but it also has its own drawbacks, right? One of which is the invasiveness by itself, which suggests the involvement of neurosurgeon teams, and of course any invasive methodologies, they'll almost increase the risk of infectious complications. And I say it would be more rational to use non-invasive methods, which enables us to minimize the risk for our patients. So we can choose a non-invasive method like a nuclear magnetic resonance spectroscopy that is highly informative and accurate. But as we all know, it has its drawbacks as well, since it's not one of the cheapest methods and it's not very convenient for dynamic assessment of the brain temperature, because we have to transport the patient to the MRI labs, and the duration of the procedure takes quite a long time, which is not that effective for measurement of the dynamics of the brain temperature. Having said that, the choice will fall on more easily implemented methods, which of course microwave radio thermometry meets. And it's such a method of the registration of the power of its own tissue, electromagnetic radiations in the range of 1 till 7 gigahertz. And we can say that it's a non-invasive methodology. It's regardingly safe. It is available, which enables the operator to make the measurements at the bedside, which is very effective in assessing the dynamics of brain temperature. So the operator needs just simply to attach the antenna to the needed area, and there you have the results. And the comparison, and in comparison with the invasive probes, the difference or the error compiles to 0.23 centigrades, and it's quite impressive, and we can say it's a very sensitive and accurate method for measuring the brain temperature. So first of all, we examined 20 healthy individuals. So we measured the body temperature with a thermometer at the axial region and the brain temperature by using the microwave radiothermometry. So we measured for 2 consecutive days with a 4-hour intervals between the measurements. And the results you can see on the slides are quite impressive, I can say. We found it that in healthy people that the circadian rhythms had a distinct and diurnal dynamics. The body temperature circadian rhythms had the same trends as the brain temperature, having the differences in frequencies and in amplitude. So the periods of one complete temperature fluctuation of the brain temperature, it exactly coincided and strictly corresponded to the circadian rhythms on the first and on the second day. The body temperature oscillation period turned out to be slightly shifted, but not statistically variated. So analyzing the results, we can say that the relationships in the temperature change in the brain and in body temperature of the entire cohort of the healthy individual reflected the general trends. So if you look at the distribution of the brain temperature on the thermogram that was acquired by using the microwave radiometer, you can see that it was uniform, and the temperature heterogeneity between the hemispheres, the left and the right hemispheres, was 1.5 and 2 centigrades. And after calculating the correlation coefficient, it gave us a medium strength bond between the two hemispheres. So next, we made the same pilot study in patients with disorders of consciousness, and the results you can see on your screens as well. It showed us that the circadian rhythms were limited within the range between 35 and 8 and 36 and 8 centigrades. It was without any noticeable periodicity. That means there are no periodicity in the temperature dynamics in patients with disorders of consciousness. So our findings, they indicate that the circadian rhythms for the body temperature as well as the brain temperature were lost. So we can see that the distribution of the brain temperature in both hemispheres were non-uniform compared to the healthy individuals who had a uniform distribution. And the temperature differences was less than 1.5 centigrades comparing to healthy individuals. They had um, the difference temperatures between 1.5 and 2 centigrades, giving us the coefficient correlation in patients with disorders of consciousness, um, which showed us that they have a strong strength bonds. Here on the slide, you can see the couple of graphs of the measurements of two different patients, and you can see uh, that the entire rhythmicity of the patients, they were disrupted and they were not rhythmic. On this slide, you can see that the thermograms obtained by using the microwave radiometry in healthy individuals, in patients with disorders of consciousness, and in patients with acute brain lesions. So when we analyze the thermograms, you can see that in healthy individuals, again, we can see that there is slight heterogeneity, and in patients with acute brain lesions, we have a high heterogeneity compared to disorders of patients with disorders of consciousness. They have almost homogeneous picture, and the difference is visible. So in conclusion to our study, we can say that the circadian rhythms in healthy individuals were preserved and synchronized throughout the 52 hours of measurement. However, the daily dynamics of the temperature change in the brain differed from the body temperature variations, which indicates that the brain circadian rhythms are autonomous from other body areas. Um, to add to our study, we can say that the microwave radiothermometry is, of course, diagnostically valuable, safe, and non-invasive tool for studying circadian rhythms of the brain temperature. And of course, it facilitates the detection of hidden rhythms disruption, as we talked previously, and that might not be reflected by measuring the body temperatures. And lastly, we can definitely say that patients with disorders of consciousness had a complete absence of the circadian rhythms of the body temperature and the brain temperature as well. Our results were published in as an article you can see on your screens. And I hope it will help us to move forward in diagnostics and um, patient management in patients with disorders of consciousness. And undoubtedly, those results that we obtained, they need a more precise and more bigger research that we are working on. And I hope in the near future we will share our new data that we obtain. If you have any questions, feel free to ask me. If you have any questions later, you can write us on those emails that you see on the screens. I hope it was helpful. Thank you for your time and attention.